What causes alcoholism? Is alcoholism a disease? Hello cruel world, this is part one of a three-part series where I'm going to address numerous aspects related to alcohol use and also the relationship it has with psychiatric disorders and also with offending. This channel is a Psych for Sore Minds. It's the only YouTube channel that covers both true crime and mental illness and is hosted by a professional consultant forensic psychiatrist. I'm your host, Dr. Sohom. I assess mentally disordered offenders for a living, so you don't have to. So I act as an expert witness for criminal courts, and alcohol intoxication is very common. I see it in my patient groups that I assess on behalf of the court. In fact, I see it more frequently than I actually see acute mental illness. In this video, I'm going to answer several questions for you, including the following. What causes alcoholism? What are the health consequences of drinking heavily? So I'm talking about both the physical health issues and the mental health issues. And also in this episode, as the same as all of my three parts of the episode, I'm going to mix it up by giving you a real life criminal case that I've actually been involved in because, in the words of Guru from Gangstar, I'm nice like that. So sit back and welcome to a Psych for Sore Minds. So what makes heavy drinkers? Well, young males in their late teens to early 20s are the heaviest of all drinkers, although there has been an increase recently in women, especially in the last few decades. There's about double the amount of alcohol disorders in males than there are in women, and in case you're interested, around 4 times the amount of substance misuse disorders, so drugs, in men. So we psychiatrists, we don't say alcoholics, we say suffers from alcohol dependence syndrome. And I will go through the psychiatric symptoms of dependence syndrome in my next episode. Incidentally, we psychiatrists, we don't say drunk, we say acutely intoxicated. And for the foreign viewers in the UK, instead of saying drunk, we might say hammered, wasted, plastered, or my personal favourite, banjaxed. Or sometimes we say pissed, or in the Scottish dialect, that's pished, or in the Irish dialect, that's breakfast. In the UK, about 1.3% of the population have suffered from alcohol dependence syndrome within the last 12 months, and about 5% have suffered with it throughout their entire lives at some point, which is actually very high. And when I researched my stats for this episode, I have to say it surprised me. In terms of the proportion of people who abuse substances in general, in the general population, it's about 17%. When you're talking about the psychiatric population of patients, it's about 40%. And when you're talking about sentenced prisoners, it's around 55% in men and 35% in women. So what causes it? Is it nature or is it nurture? Well, actually, it's a bit of both, like most things in psychiatry. So twin studies have suggested that around 20 to 25% of alcoholism is inherited. So that's in our genes. And the reason that the way they've shown this is adoption studies. So adoption studies have shown that adopted sons of alcoholic fathers are about 4 times more likely to become alcoholics themselves compared to other kids who are adopted. And just to give you another kind of angle, in terms of genetic factors, in some East Asian populations, genetically they have a less effective version of an enzyme called acetaldehyde, and that breaks down alcohol. So what that means is the alcohol products of breakdown hang around for longer in the bloodstream, and that causes things like flush reactions, palpitations, nausea. So some East Asians have a bad reaction to alcohol, so they drink less, and therefore the levels of alcohol dependency are lower. Another big factor is the social background. So alcoholics have a higher rate of a history of childhood difficulties or of their parents separating, as well as juvenile delinquency. And also occupation is relevant. So people who drink more come from certain occupations, like for example, they run pubs, obviously, journalists, people in the entertainment industry, even doctors. Substance misuse is associated with psychiatric illnesses, including personality disorders, mania, depression, anxiety, but it's kind of a complex and intertwined relationship. So some people already have a mental illness and then they self-medicate with alcohol. So an example would be social anxiety. People drink to get over it. Some people might be depressed first and then later on they develop a drinking problem to try and lift their spirits. But conversely, some people might drink first and then become depressed as a consequence later. So my next question is, what are the physical health consequences of heavy drinking? Well, there are lots of physical problems. You can get anything from liver complications, so alcoholic hepatitis. That's when the individual liver cells sort of swell and they can't function as well, which leads to malnutrition. You can get gastrointestinal problems. The most dramatic is probably the peptic ulcer. So that's an ulcer inside that can burst, and it can lead to internal bleeding and people can die from it. And you can get neurological disorders related to the brain, such as seizures or dementias, so your brain is literally pickled. Alcohol use leads to various cancers and also cardiovascular issues. It can lead to head injuries, fetal alcohol syndrome, so you might have heard of this. That's when if a pregnant woman drinks too much alcohol, it can affect their baby in a number of ways, from their baby having a low birth weight to poor coordination to hyperactivity disorders, and in severe cases, it can actually lead to the baby being born with learning disabilities. So what are the consequences of mental health from heavy drinking? This is obviously my area of expertise, and they are as follows. It can lead to depression, anxiety. It can increase the risk of self-harm and suicide. In fact, what I can say is from my experience, from the many assessments that I've done of people after a suicide attempt, I would say that maybe a quarter to a half have been intoxicated whilst they had their suicide attempt. So maybe it's impulsive, so they become disinhibited, they've had an argument with a family member, for example, and drinking makes them commit an impulsive act. Or sometimes it was pre-planned anyway, but they have the alcohol to help them take that step and to help them calm the nerves. You can also get amnesia, so blackouts due to being intoxicated. Or I suppose you could actually claim to have blackouts just to kind of, save face. So if you do or say something to or with somebody that you shouldn't have, and then you have to see them at work on Monday morning. Not that I would personally have any knowledge of anything like that. And there's also alcohol hallucinosis. So that's when you have auditory hallucinations just whilst drinking alcohol. Another rare but important disorder is morbid jealousy. So that's the overvalued idea that a partner is being unfaithful. In fact, the case that I'm going to tell you about later on in this episode is exactly about that. It's about somebody with a diagnosis of morbid jealousy. And on the very severe end of the spectrum, lifelong drinkers might get alcoholic dementia, which is known as Korsakoff syndrome. So you can get Wernicke's encephalopathy, which is like a temporary brain damage caused by very heavy alcohol use. And you can get like confusion, unsteadiness on your feet, and these eye problems. And if that's left untreated, then it can lead to Korsakoff's syndrome, which is a form of dementia. Korsakoff's causes irreversible anterograde amnesia, which means that sufferers can't form new memories. And to a lesser degree, it causes some retrograde amnesia, which means they forget previous memories. So obviously, people with this kind of disorder, they just can't function. I've assessed a few patients in my life with Korsakoff's dementia, and I have to say it's really sad because they can't even follow a conversation. They can't remember anything that's going on in front of them. They're constantly confused. When I saw them, I would introduce myself to them, I'd talk to them, and then within minutes they forgot who I was or why I was speaking to them. So can you imagine just living your whole life only in the moment and not ever being able to form memories? I suppose it would be a bit like that film Memento. Okay, so my USP, I think, and what separates me from other YouTubers and podcasters is that I can actually talk to you about real life cases of people that I've assessed. Though obviously I have to do this anonymously to protect those involved. And after the break, I'm going to tell you about a case where a man had delusional jealousy. So he falsely thought that his wife was having multiple affairs and he ended up attacking her, I'm afraid to say. So I'll see you soon after the break. So welcome to A Psych for Sore Minds. I'm your host, Dr. Sohom Das. I'm a consultant forensic psychiatrist. I live and work in London, and I assess and rehabilitate mentally disordered offenders, or what the tabloids might call the criminally insane. I work in prisons, I work in courts, and I work in secure psychiatric units, and I also act as an expert witness to advise judges in criminal trials all across the UK. This channel dissects a whole range of mental health topics. Some are related to offending and violence, like this one kind of is. And my USP is that I talk about my real life cases, as I will do after this break. Which other channel does that? There are new episodes released every Tuesday and every Friday, and all I ask in for return is that you subscribe and you give me all your money. No, just kidding. What I'm trying to say is there's something for everybody on this channel. So after the break, I'm going to tell you about the case of Mr. W. Okay, so this is the case of Mr. W. As always, I've anonymized this case and I've changed some of the demographic details. That's out of respect for the patient confidentiality and also from the victims and their families, though I can assure you that the essence of this case is 100% real. Mr. W was a man in his 50s and I assessed him in the accident and emergency department after he'd been arrested and brought in by police. What happened is he became increasingly paranoid and had these delusions and hostility towards his wife of 23 years. He believed that his wife was having sexual relationships with a number of neighbours, colleagues, and even the postman. This was all delusional, by the way. He had absolutely no evidence to back it up. And although the paranoia was always present, it was definitely much worse when he'd been drinking. And he would do some fairly bizarre kind of acts. He would wash the toilet, he would obsessively wash his wife's underwear, and he did this because in his mind it would protect him from sexually transmitted diseases. So he became increasingly angry and aggressive towards his wife. He started pushing her, he started threatening her, so just a horrible, nasty situation. On top of all of that, he would suffer from alcohol hallucinosis. So this would never happen when he was sober, but when he'd be drinking, he believed that the toilet was speaking to him and the toilet was telling him about his wife's affairs. So his wife eventually had had enough and she called the police one evening after she saw that Mr. W had stashed a bread knife under their bed. So I carried out a mental health act assessment on him. If you want to know more about that process, then I've discussed it on a previous episode. I've discussed the logistics and the protocols. Go check it out. And I diagnosed him with delusional jealousy, which is also known as Othello syndrome. And it's a psychiatric syndrome as opposed to a diagnosis. Mr. W was treated with an antipsychotic called risperidone, and he improved after a few months when he was in hospital. He also cut down on his drinking, which made a massive difference. However, despite all of this, his wife left him, which I think, to be fair, is reasonable given the consequences. I just hope that she went on to live a happy life and found a man who didn't talk to the toilet. Okay, so now I'm going to answer perhaps quite a controversial question, which I've been asked in the past, which is this: is alcoholism a illness? So is alcoholism a disease? Well, it's kind of complex because morality gets intertwined with clinical issues. I suppose for me, it boils down to how you define a disease. So there is an argument, and I've heard people say this, I've even heard doctors say this, that because the sufferer voluntarily puts themselves in that position, so they actually physically choose to pick up the can or to pick up the drink, they say that it doesn't count as an illness, compared to, say, cancer, for example. But I think the counter argument is that it's more complicated because, as I explained earlier, there are external factors, including genetic predispositions. And also, to use another analogy, if somebody got a standing knife and they cut themselves severely in their forearm, right, and say they were bleeding out, the blood is there, the blood is real, the injury is real, and so is their need for treatment. They will need stitches, they might need a blood transfusion, regardless of whether or not the cut was intentional or not. So my answer is that alcoholism is a disease, even though each individual relapse might be caused by the voluntary actions of the drinker. And on top of that, each relapse is also influenced by other symptoms, such as a compulsion to drink, and when you stop drinking, having horrific withdrawal symptoms. By the way, I'm going to talk about those symptoms and other ones about alcohol dependence and alcoholism in general in my next episode. So if you need help with alcohol issues, then I will put the links to a few resources below. Right, okay, before we finish, I've got some questions for you, dear viewer. My questions are this: have you ever experienced problems with alcohol? Do you think you're drinking more in lockdown? And do you personally think that alcohol is a disease? I'm genuinely interested to know, so please tell me your thoughts. Let's take a quick break, then I'll tell you about the next episode of the Psych for Sore Minds. So before I tell you about the next episode of the Psych for Sore Minds, I'm excited to share with you guys that I'm going to be a speaker at CrimeConUK in June 2021. It's a massive convention, it's big in the States and it's coming to the UK. If you are a true crime enthusiast, you cannot miss out. So look below for a link to get tickets, and if you put the code PSYCH, then you can get 10% off. So my next part of this 3-part series, which will be part 2, about alcohol, is talking about alcoholism, so that's dependence syndrome. I'm going to tell you about the individual symptoms in details. And I'm also going to give you another case of an offence related to alcohol. And I'm even going to, and I kid you not, tell you how to make prison hooch. So please subscribe to our YouTube channel. Not only does it help me out immeasurably, but it will put a spring in your step. And comment please on the videos below. I love reaching out and speaking to my viewers. Hit me up for a chat. Follow us on Instagram, like our Facebook page, submit any episode ideas or questions to our email, which is psychforsoreminds@gmail.com. And if you're going to reference us, use the hashtag PsychSore. So please tell your favourite people about Psych for Sore Minds. They deserve it. Spread the love. Until next time, stay euthymic and remember, I love you. Now go away.